Hi, my name is Azantolabi and you're welcome to the Eye Show. I'm excited about this episode because next week is World Glaucoma Week and eye care professionals all over the world are going to be talking about glaucoma and how you can, prevent yourself from going blind from glaucoma. And so today there are 5 things that I want all of us to know about glaucoma coming right up. So first, we need to understand that glaucoma is not equal to high eye pressure. If your eye pressure is high, it doesn't necessarily mean that you have glaucoma. And so you've been told that if you have been told that you have high eye pressure or IOP, intraocular pressure, as you hear your doctors say, it doesn't mean that you have glaucoma. So a lot of people who have glaucoma tend to have high eye pressure, but that doesn't necessarily mean that there are not people with glaucoma who have low or normal eye pressure. So what exactly is glaucoma? Now, the nerve which is at the back of your eye, which sends information from your eye to your brain, has some characteristic damage when you have glaucoma. And so it is the damage that is called glaucoma, not necessarily high eye pressure that is called glaucoma. The only trouble here and what gets people confused is that the only thing that doctors can actually vary is the eye pressure. So we're lowering eye pressure to help slow the progression of glaucoma. And the lowering of eye pressure is done by eye drops, surgery, or both. So you shouldn't be so hung up on eye pressure. Eye pressure fluctuates throughout the day, and there are some activities that you do that could lower your eye pressure or increase your eye pressure transiently, over a short period of time. Since your eye pressures are influenced by different activities throughout the day, you not get the same reading every time you see your doctor to check your intraocular pressure or IOP or eye pressure. Number 2, you are not to stop using your glaucoma medication. So if you're diagnosed and you're asked to use drops, you don't just stop the drops on your own. You have to keep using the drops all the time. So if you're given drops to use twice a day or once a day, or you're given 2 different kinds of drops where one is used once a day and the other is used twice a day, make sure that you use it every day and don't take breaks in between. So you use it and you just get tired, and so you stop for a week or 2 or even a month or 3 months. That doesn't work. You have to make sure that you're always putting your drops in and you're having your regular eye exam so that your doctor can check the eye pressures, but do not equate your eye pressures to glaucomatous damage. Glaucoma is not caused by something you did necessarily, although some of the risk factors are based on lifestyle, like non-smokers are at a lower risk of glaucoma than smokers. So the major risk factors are actually increasing age and a family history of glaucoma or genetics. So if your first degree family member has glaucoma, by that I mean your mom or your dad or your sibling has glaucoma, you're at a higher risk than somebody whose uncle or aunt or grandfather suffered glaucoma. But it is chance. So the fact that you have glaucoma doesn't necessarily mean your child will get glaucoma. So questions like what brought on my glaucoma may be difficult to answer in the clinic. So just, make sure that you know exactly what happened with your grandma or your mom. If you just know anybody with an eye problem in your family, you should know. The same goes for all types of, systemic conditions. Sometimes a relative dies, you have no idea what happened. Maybe he went to the hospital, but was it hypertension? Was it diabetes? Did he suffer a stroke? Was it a heart attack? But if there's nobody with glaucoma in your family, it doesn't mean that you cannot get glaucoma. So the main point here is know your family history. Not who gave birth to who necessarily, but who got what before they passed on, or at least whilst they're still alive. Number 4, unfortunately, vision loss due to glaucoma cannot be regained. Doctors will concentrate on preserving the vision you have left when you're diagnosed with glaucoma. And so in early glaucoma, people do not notice. And that brings me to my 5th point. The 5th point is your only sure way of knowing whether you have glaucoma is by visiting an eye clinic and finding out what is going on with your eyes. Because of the way glaucoma begins, the disease starts, people do not notice. Now, by the time you realize, I don't think I'm seeing too clearly, it's usually too late. or, well, maybe not too late, but very late in the disease course. And so you need to check your eyes regularly. There's a very small chance that you know that there's something going on with your eyes and that you have glaucoma. So you just need to have your eyes checked, have your eyes examined. I know that many eye clinics are going to be open for free eye screening exercises. So just use the opportunity and check your eyes. But you don't have to wait for free eye screening, because if you haven't had free eye screening in your community for 2 years or 5 years or 10 years and there's something going on, it will keep going on. So we'll just look at the points again. Number 1, glaucoma is not equal to eye pressure. Number 2, you don't get glaucoma because it's something you necessarily did, but you should pay attention to your family history. Don't stop using your medication. Vision lost by glaucoma cannot be regained. So please just, have your regular eye exams. My name is Asante Olabi with Eye Contact. See well, live well.
Darling, you